Hello everyone, my name is Philip. I'm a medical student and a biomedical scientist, and today I would like to talk to you about a career in the biomedical sciences. In the UK, a biomedical science degree takes 3 years, undergraduate. You can also do an additional year where you go on placement in hospital and get trained in a pathology lab to become a biomedical scientist with the Health Care Professions Council. A biomedical scientist is an allied health professional who works in hospital and supports clinical teams in treating patients and making diagnoses. As a biomedical scientist, you can work in 3 primary fields. Those fields are hematology, which falls under blood sciences, histology, which falls under tissue sciences, and microbiology, which falls under infection and control or infectious diseases. To become a biomedical scientist, you would have to apply for the undergraduate degree in biomedical sciences. This can be done through UCAS, and ideally, when I applied for biomedical sciences, I knew I wanted to work in healthcare. I wasn't sure whether I wanted to work as a clinician, i.e. do medicine or not, but I knew that I wanted to work in healthcare and I wanted to help patients. So to be a biomedical scientist, you have to have a love for science, and you also have to have a love for helping people. A degree in biomedical sciences is going to provide you with a great foundation in the sciences, and it provides you with the opportunity to either work within the NHS as a biomedical scientist or pursue further study, as I've done myself. I'm currently a graduate medical student, and my degree in biomedical sciences provided me with the best foundation to pursue the course I'm currently doing. But it can also provide you with an opportunity to get involved in research. So after a degree in biomedical sciences, you can pursue a master's in any field that you're interested in, whether it be in healthcare or in business. And you can also pursue a PhD and do research for publications. Whilst training to become a biomedical scientist, you're going to be trained in one of 3 sections: blood sciences, histopathology, and microbiology. In blood sciences, biomedical scientists are trained in how to test, treat, and analyze blood products. This is very important because patients on the ward always need blood. Within the field of histopathology, biomedical scientists analyze tissue samples that come from the hospital, for example, from patients who have had surgery for cancer. Once within the laboratory, test is done to establish the type of cancer that the patient has and the stage of that cancer and the grade. That means how aggressive that cancer is. All this work is important as it ensures that the patient receives the right diagnosis within a timely manner so they can receive the right treatment. The last but not the least is microbiology. Microbiology is all about infectious diseases, and within the laboratory, biomedical scientists work on samples to ensure that patients who have infections receive their test results in a timely manner so that they can receive the right treatment. Biomedical scientists are the foundation of the NHS. They work with doctors to make sure that patients get the right diagnosis that they need in a timely fashion. When you go to the hospital and you're unwell and you have a sample taken, where does it go? It goes to the lab. Who is at the lab? Biomedical scientists. They work really hard to help make sure that you get your diagnosis at the right time so you can get the correct treatment. Biomedical science is a fantastic career to be involved in. If you're someone who loves healthcare and loves to help people, it's the career to go for. It's going to provide you with a wealth of knowledge, clinical work experience, and also the opportunity to further study in healthcare or science.